So Candy Crommel has been our nurse consultant for over a decade. Her two little beautiful girls started with us when they were in preschool and elementary, and now they're looking at graduating high school. So we've had a great long run with Candy. She's been fantastic. I'm not sure what your nurse consultant does for you, but let me share you a little bit about what ours does for us. On a monthly basis, Candy comes by. She reviews our med admin book. She reviews all children with allergies. She goes through our medicine cabinet. She looks at prescription labels. She looks at health plans. She looks at dates of signatures. She completes the med administration course, does delegation for us, all on site. With any extra time, she goes around our center to visit with staff that have questions, if it's cold and flu season or if we've had some hand, foot, and mouth. She does all of these things. Let me tell you what Candy doesn't do for us. She doesn't record immunizations, because for me, any administrator can do that. My admin or my directors can go in and pull up immunizations of children. They can verify that with immunization forms that parents turn in. The busy paperwork, I don't have Candy do. I want her available to be able to help us with the day-to-day. Are we ready for the next or any kind of a medical emergency that comes up? So one thing she doesn't do is get behind the camera. So I'm going to share with you a little bit of a Q&A that I had from Candy here today. So let's see if we can go to that. So we're here with Candy Crommel, and for privacy reasons, we've dubbed in her stunt double. Candy, talk to me a little bit about common illnesses of children. So, all kinds of fact and fictions thing. Let's talk about pink eye. Pink eye is?
A virus.
Okay, pink eye, and you said before it's
like having a cold in your eye.
Like having a cold in your eyes.
Mm-hmm.
High concern, low concern.
Pretty low, but it can be spread fairly quickly. So they have to wash their hands a lot. And it's probably best if they're not here.
Right.
Because it's so contagious.
So the idea of a toddler that can't keep their hands out of their eyes, bigger concern?
Yeah.
Versus a 5-year-old that can wash his hands
Absolutely.
And is comfortable enough to be in our program and doesn't
Correct.
have his hands in his eyes.
Correct.
But virus, so...
Has to run its course. It's about, it usually goes from one eye to the other, and it's maybe 3 to 5 days per eye.
And what about antibiotics for pink eye in the eyes?
A lot of the docs won't give them because it's a virus.
Let's talk about the common cold. High concern, low concern.
Low concern. If they have a fever or anything, up around like 101, might want to consider treating that, but the doctor would give guidance. But it's, there again, it's about 10 to 14 days. It's going to run its course.
Right.
Certainly if any nausea or vomiting comes into play there, or anything like on a small kid, if they see any lesions in the mouth, on the hands, hand, foot, and mouth, which is another issue, and that has to run its course as well.
Yeah, and of course all centers are going to have their temperature sent home. Ours is 100. We like to follow the local school district. It's kind of a good backdrop for us. So how about vomiting and diarrhea? Biggest concerns and things to watch out for with that?
Well, if they're vomiting, they need to go home, where they're more comfortable and can recover from that. Unlike the school district, they need to be free of vomiting for 24 hours before they can come back.
Correct.
Same with fevers.
Right. And we use the district health policies and state guidance, and so that becomes our policy as well.
Yes.
How about measles? High concern, low concern?
Pretty high.
I imagine. Yeah. How about ringworm?
Well, that can be spread pretty easy as well, but you do the fogging here, which I would highly recommend, because it can, they can get it from mats and that type of thing. So the source would be pretty important to determine. But they would want to get treatment for that, and they'd need a note from the doctor to come back. Right.
Always the best rule of thumb is get a note from the doctor to say they need to be out for a certain amount of time. Correct. Or they're okay to come back after a certain amount of time, right?
Yes.
How about hand, foot, and mouth? High concern, low concern?
Pretty high, very contagious, viral, but spread pretty quickly.
Right. Talk to me about strep.
So strep, they need to be on antibiotics for 24 hours before they can come back. And of course, they need to be fever-free for 24 hours before they can come back.
Let's talk a little bit about croup. High concern, low concern.
Croup is a fairly low concern. It's viral and it's going to run its course. Does not typically require antibiotics. However, can often require a steroid if there's a lot of breathing issues, sometimes a nebulizer or an inhaler. So it would certainly be important to get a note from the doctor.
Yeah. And of course, there's lots of kiddos that have food allergies. Always something to look at your center to really understand their policies on food allergies, on how they handle that, working with the cook to make sure that they have all that information about kiddos,
Yes.
what they can and can't have.
Yes.
I know 5 years ago we went peanut tree nut free, and it wasn't that big of a change for us, but it certainly raised everybody's awareness there. But any other thoughts on food allergies?
No.
Well, thanks, Candy, for spending some time with us and just giving us a little rundown, just as a way to assure staff and get you a little bit of background knowledge on some of these common illnesses we'd see in a child care center. Could you repeat that? What about strep?
Fever.
Talk,
They need to be.
you got to hang on. You got to edit point. Talk to me about strep. Hey, you guys, can you whisper quieter so you're not on the back of the mic?